Alpaca is the latest solution in semi-automated packing. It's straight out of the factories at Yokohama in Japan, and it's the latest in the portfolio from Amneal Pharmaceuticals.
Joining me now on Pharmacy News is Gos Glavos. Thank you so much for your time once again.
No, it's great.
I just wanted to talk a little bit about some of the key research findings on consumer perceptions of DAAs. Can you tell me a little bit about that?
Yes, it was interesting. At APP we launched some research done by McCrindle's. Amneal sponsored that research, and it was very important because the research showed that we have to explain even what a dose administration aid is in more consumer-friendly terminology.
Sure.
So it was this research on consumer attitudes to these devices. We're worried, have they got a stigma about them? With more Australians just having to be able to look after their own health at home, our health system and our economy will not cope. 875 out of 1,000 people in 10 years' time over the age of 60 will have to manage their own health at home. One of the key issues why people end up prematurely in aged care facilities is the loss of medication management. The lessons coming out of it is we need to explain the visibility of the products.
Okay.
Their use of the pill boxes, the research clearly showed. So they said they want their medicines visible. Now, all DAAs that I know, they are visible. So I think we should be using terminology like the cost per day, because they're quite inexpensive in real terms, but we need to explain that cost benefit to the consumer. There's a lot of lessons for pharmacy in having these devices at the counter, giving consumers an example or even offering a trial period. I mean, it was fascinating that 2 out of 5 patients, when we stripped out patients who either were already using a DAA or but anyone on chronic therapy medicines, if my pharmacist recommended this is what I needed, they would be happy to transfer to such a system. And more importantly too, it was an even higher percentage for doctors. So a lot of doctors don't understand these devices and how they've perhaps seen them, but how the pharmacist orders and manages that stock. And the other interesting one in the research was consumers also want their complementary medicines. Now, a lot of my colleagues may not appreciate that a lot of patients take some of these chronic therapy complementary medicines. So the lesson for the pharmacist is don't just think of prescription medicines when you're talking about dose administration aids and packing for the patient. If the patient wants their arthritis complementary medicine packed, then that's a great opportunity and it'll improve compliance in those as well. There's lots of opportunities. It's a growing market with the ageing population. DAAs are a great tool, and I guess the research shows that we need to think more from a consumer perspective on what we call a product, how we display the product, how we market the product. They're regular customers, so the softly marketing approach, say, look, Ms. Smith, you're on 5 more medicines. Even if you've done a compliance report, say, look, Ms. Smith, I've done an analysis on how you're going with taking your medicines. Yeah. Now, you've got a Meds Index score of 83. Now, in simple terms, what that means is you're missing, out of 100 doses, you're only taking 83.
Yes.
Now, that's the equivalent of not taking your medicine for 2 months of the year, Mrs. Smith.
Absolutely.
So when you put it in simple terms like saying, well, you haven't taken your medicine for the equivalent of 2 months of the year, then patients go, really?
Sure.
Whereas with a Meds Index score, which the pharmacist can easily access out of their software, they can identify how good a patient is at taking their medicines, because over a long period of time, it measures when they're coming in.
DAA growth in the community market, as we've heard from many of the speakers this week, it's really the growth area of pharmacy. It's something pharmacies really have to start paying attention to. So it's all well and good to give pharmacies automation and to increase their efficiencies and profitability, but at the end of the day, the pharmacies really want to grow their business. Of course, it all rolls up to Alpaca, which everybody is excited about at APP.